Hello everyone, I hope all of you are doing well and are safe. Well, this video is going to be really helpful for you because we'll be talking everything about a pulse oximeter, starting from how it works and how you should use it properly, what are the best practices, when should you seek medical assistance, and how you can use it to help others in and around in your family and also help yourself, of course. Hi guys, and welcome back to my channel. I am Dr. Noor Saira. I am an endodontist and a part-time YouTuber. If you're new to my channel and haven't subscribed yet, please subscribe and hit the notification bell icon so that you're notified every time I upload a video. In this video, we'll be talking completely about the pulse oximeter, a topic which is the need of the hour, which can probably help you and help your family members. Well, this is going to be a little bit on the longer side. So I have made chapters that if you want to know anything specific about a pulse oximeter, you can skip to that chapter. Otherwise, you can watch the whole video so that you have an entire information about the pulse oximeter. Well, let's begin to understand what a pulse oximeter is. Well, pulse oximeter is a non-invasive device which basically helps you to determine the oxygen levels in your blood at that specific amount of time. It basically checks the oxygen levels in the blood, just like how a thermometer checks your temperature. Now, apart from checking the pulse or the blood oxygen levels, it also checks your heart rate, which is represented as HR in the device, and the oxygen saturation levels are represented as SpO2. Now let us understand how the device actually works. Well, it's basically a clip-on device, as you can see, into which you can stick in your finger. And in this device, there is a system which basically emits the light, that is a red light, that is an infrared light. And on the other side, you have a sensor or a detector. So what happens is when you place in your finger and you switch on the device, the infrared light basically passes through the device, through your finger, through your blood, and it is absorbed. The red light is absorbed in the blood depending upon the oxygen levels in the blood, and the rest of the amount of blood of the infrared light is basically accumulated or collected by the detector or the sensor, and depending upon the light that is remaining and that is collected by the sensor, a ratio is calculated, and this represents the oxygen saturation levels in a form of a percentage. So this is how the pulse oximeter basically works. To move on to understand the importance of pulse oximeter in COVID-19 situation is that, in COVID-19, what happens is one common phenomena that has been seen is something called as the silent hypoxia or the happy hypoxia. Most of the patients of COVID in which it gets detected late, that the symptoms arise late in COVID-19 patients, what happens is that the oxygen saturation levels are dropping, but the symptoms are not there. That is, the shortness of breath is not there, and this symptomless hypoxia is called as happy hypoxia or the silent hypoxia. So if you happen to detect your pulse or the oxygen saturation dropping earlier, if you're able to identify earlier, you're able to seek medical assistance earlier, and hence you're able to save more lives or save yourself earlier. So how do I work with this, or how do I use the pulse oximeter? So the one thing that I advise when using the pulse oximeter is that you make sure that there is no dirt anywhere. That is, there is no dirt in the pulse oximeter and there is no dirt on your finger. So you make sure that you clean the pulse oximeter inside with the help of a dry tissue paper. Make sure it doesn't have any moisture inside. You make sure that your finger is clean. One important thing that I need to tell you is that your finger should be free of any nail polish or any henna for that matter. Now, you would ask me a question, what should I do about when I have a nail polish or when I have henna on me or a tattoo on me which I cannot remove? Well, for a nail polish, it's simple that you go ahead and remove the nail polish. But in conditions where you have henna or a tattoo and it is an emergency condition, I will tell you what alternatively how you can use the pulse oximeter further into our video. Well, in a normal situation where you have no henna, no tattoo, or no nail polish, I would advise that you rest down for 5 minutes, you sit down for 5 minutes, so that your heart rate is relaxed and your blood pressure is relaxing, and you can also see your normal oxygen saturation levels. After which you will switch on the device. In certain devices you have to pre-switch the device, or in certain cases the device switches itself on when you place a finger inside. So you place a finger inside after the device is switched on, and you can see that certain waves are forming on the device. And after a period of 30 seconds or to 1 minute, when you have kept your hand stable, you can see the reading on the pulse oximeter. So the reading which represents as a percentage, or the SpO2, is my oxygen saturation levels, and the one which represents as BPMR, that is nothing but beats per minute heart rate, is my normal pulse rate or my heart rate. So this is how I would record my pulse oximeter reading, that is my oxygen saturation level reading. Now in certain times what happens is that you will see that the readings are just fluctuating and you are not getting a normal reading. In such cases, it is preferable that you take the highest reading and you record it in your diary, after which you can remove the pulse oximeter, put it in a different finger, and then you record it. Now otherwise what you can do is you can remove it and put it in a different hand. Still, if you're not getting a normal reading of your oxygen saturation from the pulse oximeter that you have, it's important that you check that it is working correctly. So maybe you can check the pulse oximeter in your family member to identify if the pulse oximeter is reading right. So for them, if it's reading right, and for you, if it's not reading right, then maybe you have something to worry about. Otherwise, in most of the cases, it does read right. Well, a lot of people have a query as to which finger is the best finger to record the pulse oximeter reading. Well, it is said that the right hand middle finger and the thumb, they tend to have the highest blood flow, and they tend to give a better reading when compared to the other fingers. However, all the other fingers do function the same, and they provide the readings. In case you're getting fluctuating readings in your other fingers, the best fingers to record is the middle finger and the thumb. Now that you have your readings, let us understand what they mean. Now we have something called as the BPMR, that is beats per minute heart rate. It's nothing but your normal heart rate. If the normal ranges of the heart rate are between 60 to 90 beats per minute, that's the amount of beats your heart takes in a minute. Well, the next value that you will have is a percentage value, that is the SpO2 in form of a percentage. That's your oxygen saturation levels. Well, the normal oxygen saturation levels is between 95% to 100%, and anything below that is considered to be thought about. Well, one important thing that I want to mention here before I mention when to seek medical assistance is that in certain individuals with an underlying respiratory problem, like that of an asthma or that of chronic obstructive pulmonary diseases, or people who are slightly on the obese side, their average normal oxygen saturations level might be lower than normal. That is, for them, even 93% or 94% might be considered normal. So the best advice that I can give you here is, before any form of a COVID infection or before any form of an unhealthiness, it's important that you purchase a pulse oximeter with you, because given the situation of COVID, you monitor your pulse oxygen or your oxygen saturation levels even in a normal situation, so that you understand what your normal average is. So that if it falls beneath that, you have an idea that now it has fallen below my average. So it's important to understand what your normal average is. If you have some form of underlying, lung diseases or respiratory diseases, or if you are slightly on the obese side, or preferable even if you're healthy, it's important that you determine your normal average levels of oxygen saturation, because the situation, that is the COVID situation, is as such. This will help you identify if in case you get infected with COVID at a faster level, and you can seek medical assistance faster. Now that we know this, and let me tell you what is the range of percentage of oxygen saturation where you need to seek medical assistance, and that saturation levels are 92% or lower than 92%. Now, but it's even better that you take a consultation for yourself when it starts to fall beneath 94%. But 92% is where you actually need to start getting medical assistance in a hospital, so that it does not fall below that. Well, the next important thing that I really want to talk about, and I feel it's really important and it can be very, very life saving, given the situation and given the representation of COVID-19 cases. Well, we know a lot of patients are usually asymptomatic carriers, and a lot of patients usually develop the symptoms very, very late. Hence, the COVID-19 is identified late and it becomes life threatening in nature. Now, we know one of the representations of COVID is something called as the happy hypoxia, wherein the infected individual does not represent with the symptoms of hypoxia, that is the shortness of breath, even when the oxygen saturation levels have dropped below the normal. Now, and only they develop the symptoms of hypoxia when they have the oxygen saturations have fallen way below, and it becomes a little difficult to save the patient, or it becomes life threatening in nature. So what do we do in such a scenario that can actually help us identify the hypoxic nature or the shortness of breath or the lung damage earlier, and it helps us save the patient earlier or help us save ourselves earlier? There's something called as the 6 minutes walk test. Basically, it is a test which is done in individuals who have an underlying lung diseases. So it's normally done in these kind of individuals who have an underlying lung disease like that of asthma or chronic obstructive pulmonary disorders. So in such patients, what happens is when they walk for 6 minutes, they start feeling breathless, and when you check their saturation levels, it would have dropped from their normal saturation levels. This helps us understand about the lung damage and the amount of lung capacity that it maintains in relation to the oxygen saturations. So what do we do in case of a doubt, or when we think that we might have the COVID infection, or we think that we are infected with COVID and we do not have hypoxia in a resting stage, or we do not have shortness of breath at rest, and we do have some symptoms of COVID, maybe like cough? So it is important to do the 6 minutes walk test to identify damage of the lung or future development of hypoxia. Because at rest, currently you're not having hypoxia or you don't have shortness of breath. So what do we do in such condition is that first we record our oxygen saturation levels at rest, and you write it down in your diary. And then when you do not have any form of oxygen saturation drop, what you do is to identify whether you will have a future drop of oxygen saturation levels. You can take a 6-minute walk test unassisted and see if you're developing shortness of breath, and if you are having other symptoms, and also record your oxygen saturation levels after that 6-minute walk test and identify what are the levels, if it is below 92, or if it has dropped 3% or more from your normal average resting level oxygen saturation percentage. So this will help you identify earlier and seek your medical assistance earlier. So if it is dropped below 92%, or if it has dropped 3% further than your normal oxygen levels, then it is a positive test. So this 6 minutes walk test can help you understand your lung condition and your oxygen saturation levels, and in case there is a further drop in oxygen saturation levels below normal, you can always seek medical assistance before you go into a more complicated situation. So this is how the 6-minute walk test helps. Well, the 6 minutes walk test should not be used in people who are at shortness of breath, even at rest. It should not be done in individuals who have oxygen saturation levels below 93 or 92% at rest, or who should not be done in individuals who have very severe underlying chronic respiratory problems, so that complications are not developed. So what do we do if I have some pigmentation, or if I have henna, or if I have a tattoo, or if I have a nail polish, and if it's an emergency condition and I don't have time to get rid of it? How do I record my oxygen saturation levels? Well, the other alternative is to record your oxygen saturation levels on your toe. And but one thing that you have to make sure is that your toe reaches the sensor completely, and this will give you the normal pulse or the blood oxygen saturation levels. Even if that is not possible, you can always use your earlobe to record the oxygen saturation level. Another important thing that I would like to communicate, keeping in mind that the third wave is coming soon, and it is said that the third wave will probably affect the children more when compared to the adult category. Now, it is important for us to understand how to record the pulse oximeter reading in a child. Well, in a child, you have to follow the same protocols of making sure that the pulse oximeter is clean. You make sure that there is no pigmentation on the nail or on the finger, and you record the reading by placing the finger inside. But what happens in case of toddlers or children who are less than 5 years of age? Their fingers are usually not so long enough to go completely into the pulse oximeter sensor, so it's better to use the longest finger, that is the middle finger, and you can place the finger completely inside. You make sure that you hold their hand to make it steady for at least 30 seconds, and this will help you record in the pulse ox or the blood oxygen saturation levels. Now, in case the child is not very cooperative and he does not allow you to use the finger, you can always use the toe of the child and make sure that the toe reaches the sensor, and you have to keep it steady for at least 20 to 30 seconds, and you can have your oxygen saturation levels recorded. Well, this was all the information about pulse reading, the oxygen saturation levels reading. I hope that this video was beneficial and it was very helpful to you. I hope everybody remains safe, and please be cautious. Please record your pulse oxygen saturation levels. The more easier, the faster the identification, the more easier it is to give medical assistance. Please comment below if you like me to help in any other way, and please do like and share the video with your loved ones, because I understand that the situation is bad and this is the need of the hour. Keep safe, keep happy, and thank you for watching the video. For more such videos, please like, share, follow, and subscribe my YouTube channel. You can also follow me on Instagram. Have a good day. Thank you.